Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. The title for this program is Rising Rates of STIs, and with me I have two experts from the Wicomico County Health Department. First, I have Dr. James Cockey. You are the Physician Deputy Health Officer at the local health department, and Chavonda Carr. You're a certified community health educator. Thank you very much for coming in today to talk about this important issue here and nationally.
Pleasure to be here.
So first, Dr. Cockey, if you can just enlighten us as to the numbers. Where are we in terms of STIs?
STIs nationally and throughout the state and in Wicomico County have been going up the last couple of years. Wicomico County in 2012 had the highest rate of gonorrhea and chlamydia of all the counties in the state of Maryland. The only jurisdiction with a higher rate was Baltimore City. And for many years, the lower shore, along with Prince George's County, has been among the highest per capita rates of gonorrhea and chlamydia, particularly Wicomico, Dorchester, Somerset, and on the other side of the bay, Prince George's County, as well as Baltimore City. After we were faced with the very high rates in 2012, we made a major public health effort through the health department leading a local sexually transmitted infection task force, and had remarkable success through 2015. Each year from 2012, we had reducing rates of sexually transmitted infections. 2016, they started going up again, and we recently got preliminary data for the whole year, which showed a 23% increase in total cases of chlamydia and 29% increase in total cases of gonorrhea. And the per capita increase will probably, when the data is finalized, be somewhere in that range. Nationally, the rates are increasing. For the most recent data is 2015, but they're in the range of 6 to 8% increases. So it's a concern all over the country, a concern all over the state, and there's been a particularly big impact in Wicomico County. So our STI task force is once again increasing our activity to try to accomplish interventions to reverse that, and that's one reason we're here today.
Well, if you can just give us an overview before we concentrate on gonorrhea and chlamydia. There are other sexually transmitted infections, we call them now, not diseases. What are they? And then we'll get into more detail about gonorrhea and chlamydia.
The most common ones include genital warts, include human papillomavirus, include herpes simplex. Another one that for 2016 has not been a major issue in Wicomico County is syphilis. There's other more obscure ones that we rarely run into. The one that is most frightening and the cause of the greatest number of deaths is HIV and AIDS.
Okay, we'll talk a little bit about that later in terms of how that's linked to some of these lesser problematic infections. So I guess, do you want to start with gonorrhea, talking to us about what is gonorrhea, how does it spread, the symptoms? Gonorrhea
and chlamydia clinically are pretty similar. They're both bacteria. They both are spread primarily sexually, although they can also be spread from mother to child at childbirth. They both are very commonly asymptomatic, so a person who has had what might be thought of as a risky sexual exposure may be totally asymptomatic and still be infected and still capable of spreading it to other people. When they are symptomatic, they cause a pussy discharge, and it's very noticeable in a man, but less noticeable in a woman. And in a man, and less commonly in a woman, they can cause very painful urination. Those are the symptom stages of it. The complication stages can be devastating, particularly in a woman. That can lead to pelvic inflammatory disease with horrendous pain that needs surgical intervention, and that can also lead to permanent sterility in a woman if the infection gets up into the tubes. And if a baby is infected during childbirth through the birth canal, it can lead to eye disease and blindness in a newborn.
So that sounds pretty significant then. Now, what are the treatment? I know they're different.
The treatments will have changed over time and will continue to change, particularly for gonorrhea. Gonorrhea, over the last 50 years, has shown an extraordinary ability to develop genetic mutations that lead to resistance to antibiotics. And all microorganisms do that, but gonorrhea seems particularly capable as a species of doing that. So the current preferred treatment nowadays involves an injection of an antibiotic plus a second antibiotic. The injectable antibiotic is ceftriaxone or Rocephin. If we go back 10, 15, 20 years, we could take care of it with a pill or sometimes 2 different pills. That is no longer the case because there's so much resistance to gonorrhea that the only way to get reliably adequate blood levels of antibiotic to kill it is with injection. And one of the big concerns with gonorrhea, because it is so able to develop resistance to antibiotics, is that we may be facing a future where we don't have any effective treatment for antibiotic, and that's for gonorrhea, which is a very frightening thought. It's part of this whole trend towards superbugs that are increasingly difficult to treat, and there are concerns that gonorrhea could be going that way. Now, there's a lot of research going on to develop other treatment combinations that might be effective. It's a concern. It's certainly not happening yet.
And then chlamydia, you're saying you can, antibiotics, but by pill.
Chlamydia clinically is very similar to gonorrhea. Chlamydia, it is the case in Wicomico, Maryland, and everywhere. It's far more common. It's 3 to 4 times higher per capita incidence than gonorrhea.
Well, I know one of the reasons why this doesn't seem as a problem to some people is that there's a feeling among a lot of young people that, oh, you can just take a pill or get a shot for that. Yeah. Well, there are repercussions to
there are,
getting these infections.
We just mentioned the serious potential long-term complications. Short-term, and this is particularly relevant since they're so often asymptomatic, if a person has a sexual contact with someone else who is HIV infected and may or may not know it, it is not the case that every time there's a sexual contact that the HIV is transmitted. And there's all sorts of complicated details that determine the probability of transmission of HIV. But one of the things that increases the risk of HIV transmission is the presence of inflammation related to other sexually transmitted infections. So if either the infected person or the uninfected person has an STI, including gonorrhea and chlamydia, the efficiency of transmission of HIV it's more efficiently transmitted, and there's a greater chance of the HIV negative person becoming HIV positive. And it is true that we have had remarkable success in treating with commonly available antibiotics, treating gonorrhea and chlamydia, and that's also true for syphilis, which currently in Wicomico is not as big of a problem. It is still the case that they have to be treated. They aren't always, you don't always know you have them, and there is significant concerns about resistance to antibiotics, to available antibiotics.
So in your mind, I mean, we know drugs and alcohol and other risky behaviors lead to perhaps, sexual encounters that may be risky, but you're saying one of the biggest concerns is some of the long-term effects.
Sure.
They don't have symptoms, you may not know.
And the increased risk of acquiring HIV infection.
Yeah.
And HIV, as we all know, is not curable. It's treatable nowadays, and we have wonderful treatments for HIV that can keep people alive as long as they're taking it. But we don't have a cure. There was a time when people were very frightened and upset about gonorrhea, and then in the modern era of antibiotics, from the 40s on with penicillin and others, it did become readily curable, which I think has led to a sense of overconfidence and particularly young people not taking it terribly seriously, which is understandable but unfortunate.
I guess we can say that about a lot of things with this whole superbug thing. Oh yeah, we got a treatment, and then suddenly it doesn't work, and then you're back to being more concerned. But I guess the general public's concern lags behind a tad, so that's why we're where we are, and that's probably what makes your job so challenging, Chavonda, when you're trying to change attitudes.
Definitely, definitely.
So Dr. Cockey, can you just reiterate, we know this is mostly a concern with younger peoples, but what is the exact age group you're most concerned with?
The epidemiologists divide up the age groups for statistical purposes from 15 to 19, 19 to 24, 24 to 30, and then higher. And every year, as you might expect, the rates are highest in the 15, 19, and 20 to 24, and that's also true currently. When a lot of kids become sexually active and maybe don't have the experience and wisdom that they'll pick up in later years, and sometimes do a lot of sexual experimentation, particularly when they get to college. So those are the times for chlamydia and gonorrhea when the rates are the highest here and everywhere else.
Well, that leads me to Chavonda. Now, you are a certified community health education specialist, so obviously you do a lot of work in this area, doing education in the local community. So I guess I want to ask you about, before you even can think about offering educational programs, you have to change attitude to some degree. So what kind of challenge is that to get young people to listen about what they can do to prevent STIs in themselves and spreading them to others, and realizing that it's not just an easy fix with a pill, and it can be some serious repercussions?
Well, that can be hard because young people have the idea that I'm invincible and nothing can happen to me. And so a lot of young people that I work with will say, oh, well, it happens to other people, but it won't happen to me. Or I can tell by looking at a person whether they have a sexually transmitted infection. And so to get them to understand that, you know what? It can happen to you, and it doesn't matter what the person looks like. Some of the young people might say, well, it's because a person's not clean, or you can wash them off, and it's not something that you can wash them off. And the only way you can tell if you have it is if you go and get tested.
So I guess you just have to do a special educational focus on it's not that easy, and you can't tell by looking at someone.
That's the major misconception, is that, oh, you can definitely tell, but you can't. You definitely have to go and get tested.
Well, I think what's scary is the fact that, especially for women, it's hard to know that you may have one of these infections, and you unknowingly. And then I guess in some people they may know and just don't care. So that's hard to address, I imagine. So
Definitely.
So what are some of your program interventions to help change, to help address this rate increase, reduce the rate of them, and so on?
Well, first of all, with the Sexually Transmitted Infection Task Force that we created a few years ago, we brought in a professor to Salisbury University, and they actually did a spring break intervention for our students, and that was well attended with college students, to let them know these are the sexually transmitted infections out there, these are the signs, these are the symptoms, and this is where you can get tested. And so we did that. We've established our webpage, the wicomicohealth.org. We've also created things like adolescent health resource cards, and we can distribute that through the Board of Education. We've also established posters on sexually transmitted infections as well as teen pregnancy, and those are some of the things we do in the community. Also, I am a guest speaker. I'm invited to either the 8th grade or the 10th grade health education classes for the Board of Education to come in to speak on sexuality topics at times.
So you have a nice collaboration with the Board of Ed so that you can get this information into the high schools, since that's a risk group?
Definitely. And so we also have programs funded by the Maryland Department of Mental Health and Hygiene. And there's 3 of them I want to highlight today. And one of them is the GEMS program. And that's an abstinence education program that's at Bennett Middle School, Salisbury Middle School, and Wicomico Middle School. And that's an abstinence-only intervention, and it's been in place for almost 20 years. And so we have had over 1,000 young ladies to actually go through the program, where we educate them on puberty, reproduction, personal hygiene, self-esteem, healthy relationships. And we talk about, role plays, refusal skills and things like that, so that they can, have all the tools that if they are in a relationship that they can actually use.
Well, I'm sure that helps with their confidence to
Definitely.
make decisions of that nature.
Definitely, and we've had amazing success with that particular program. We've had a lot of young ladies to go through the program, and so that's one of our successful programs for Wicomico County.
Well, that's the best prevention, isn't it? Abstinence.
Definitely. But we also have another program. It's called the Personal Responsibility and Education Program, and that's with abstinence, safer sex, sexually transmitted infections, and that is implemented in the community. We've implemented it through Department of Juvenile Services. We've implemented it to some of our mental health agencies. We've implemented it through Upward Bound. We've implemented it through various other agencies and community groups in Wicomico County. And that is typically an older age group, between the ages of maybe 12 to 19 years old, where we want to get out the word that there are sexually transmitted infections out there. This is the way that you can protect yourself. Also, we talk about birth control methods in that particular program, as well as we highlight what's called adult preparation topics. So we not only want to talk about sexuality education, but we also want to talk about career and educational success.
Oh, nice.
Because if you have goals and dreams for the future, you might not get into some of the other things. Other things that we talk about, financial literacy with that particular group. We also talk about healthy and unhealthy relationships, and that's really, really important for this particular age group. And so we do that particular intervention in the community. And then the last one, because we do not want to forget about our parents, because we feel like parents are the primary sexuality educators. And so we have a new program called Parents Matter. And that is a 5-week intervention in which we will teach parent or guardians to really talk about what's really going on in your young person's life, but also how to talk about some of the sexuality issues. It can be awkward. Mm-hmm. It could be uncomfortable, but how do you go about it? And so that particular program is our newest program that we are promoting right now in order to be able to help out parents and guardians through this particular time period in their lives.
Well, that sounds like you have a lot of really excellent approaches to this. I mean, I think gone are the days years ago when, you just went to a class in 7th grade and just learned about diseases. Now you're expanding it to other issues regarding self-esteem and that kind of thing.
Definitely. Our young people have so many questions. And a lot of the questions that young people have is, am I normal? And so all of our programs really want to address that. Am I normal? They want to talk about puberty and reproduction and what's going on with their body. Mm-hmm. And so it really helps them if we're able to educate them on that. And so they can see, okay, well, maybe I shouldn't do that particular thing. Or maybe I should wait until I'm older. Or maybe I should wait until I'm married.
Well, I guess the other thing is when you're dealing with young people, they're going to go on the internet and look things up. So I guess one thing you might do is let them know which are the better websites to look at versus going down the wrong road and getting misinformation, which fuels these misconceptions they may have about STIs.
Definitely. That's part of our program as well. We definitely want to make sure that we're giving them medically accurate information and steering them in the right direction, but also looking at the dangers of social media and actually people, going through and using the social media apps to, find relationships and things like that, and how dangerous that can be. So we do alert them to the dangers of the internet.
Right. Well, we'll post some of the websites that you suggested at the end of the program. So as we wrap up, Dr. Cockey, can you give us your take-home message on this topic as Physician Deputy Health Officer?
sexually transmitted infections are present, they're increasing, they can be serious and devastating. And my hope is that young people particularly will understand this, take it seriously, protect themselves, and there's lots of ways of doing that, and get tested.
Well, very good, and thanks to both of you for taking time out of your busy schedules to come to PAC 14 and get this important information to our viewers.
Thank you.
Our pleasure.
And thank you for joining us for this edition of Focus on Health here on PAC 14.